looks great in this black belt. Go ahead.
Good morning, Fairview Haven family. I have some good news to share with everyone this morning. We are officially out of outbreak status as of yesterday, as of this morning, I guess. So we are very thankful for that. And that doesn't bring a whole lot of changes, but it does bring some very important changes. And the first change that I can announce for staff is you can remove these silly N95s. You do still have to wear a face mask, so please wear a face mask, and you have to still wear eye protection whenever you're in the nursing home, wherever you were wearing it before. So that's still important. The reason we still have to wear eye protection is because Livingston County is still considered a high-risk community. So that means that our case count is still too high. We are at 1.92% positivity rate, which is awesome. But our case count is 244 cases. That was as of Friday, October 8th. That's 244 cases per 100,000. So I think it was like 87 cases total for a week. So the numbers are falling, but actually that was an increase from the beginning of the week. So hopefully they'll keep going down and we can get down to moderate and we can take off our eye protection as well. As far as residents, some changes that will be happening with the outbreak. First of all, new admissions. If the resident coming in is vaccinated, they will no longer need to quarantine upon admission. So it's only those residents that are not vaccinated that will need to quarantine when they move into Fairview Haven, or if they return to Fairview Haven from the hospital or from an outing of some sort, 24 hours or more. You are permitted to leave for outings. You always have been, but you would have had to be quarantined before. At this point, you will not be quarantined if you go out, so outings are now permitted. We just ask that when you go out that you follow the IDPH guidelines, which would tell you that you need to wear a mask whenever you're in an indoor building. We would encourage you to please follow those guidelines. Upon return to the facility, we are doing what we would call a risk assessment, so we would want to know where you were at and what you were doing and so forth. And if it's a high-risk situation where you maybe were in contact with somebody with COVID or something like that, you would maybe have to quarantine at that point, but otherwise you typically will not need to quarantine unless you're out for 24 hours or more. And at that point, then we'd have to look at the situation. Residents are asked to please wear source control, which are face masks, anytime you're out of your room. That's not changed. We have to continue to do that. You'll be able to remove them obviously when you're eating in the dining room, but otherwise we ask you to keep a face mask on at all times. If somebody comes into your room, you should also put a face mask on at that time. We are back to fully vaccinated residents may participate in communal dining and group activities, which has been happening without social distancing. Still need to wear a mask, unfortunately, but you don't have to follow the social distancing rule if you're vaccinated. Unvaccinated residents still need to physical distance whenever they're out. As far as team members, I told you already the N95s are gone. That is, of course, unless you're caring for someone that's suspected of COVID or has COVID, you would obviously wear an N95 at that time, as well as all the other PPE. Vaccinated team members no longer need to test unless you're symptomatic or if you've been exposed to somebody with COVID. And we will direct you with that. So if you have any questions about that, you can ask us. Unvaccinated staff still need to test on a bi-weekly basis. So every Monday and Thursday, you will be required to test out in the maintenance shed like we've been doing. At this point, we're continuing to do that from 6 to 6 on Monday and Thursday, as long as we can get volunteers and they're not too bored. We'll continue to do that instead of doing it in here like we were before. We can go to weekly testing once the county is down to moderate risk. So right now we're at high, we go down to substantial next, and then we would go down to moderate. And at that point, we can go to weekly testing. And then as far as visitors, the building is open again to visitors. So you are welcome to invite your loved ones in. We do ask at this time, we're not going to limit visitors, so anybody is welcome. We don't limit the number of visitors, but we do ask, and we are recording this for families and the public, but we do ask that visitors please be mindful and, don't everybody rush in here at once. We want to take it slow and use reason. Also, for visitors, please don't come if you've been exposed to COVID, or if you happen to be positive for COVID, obviously, or if you have any symptoms that are related to COVID. And I would just say this, symptoms could be allergies, so please don't just assume that you have allergies and come out and visit our loved ones here. We want to keep COVID out of the building, and so let's use good caution on who we let into the building. Residents who are isolated because of suspicion of COVID or anything will not be permitted to have visitors, otherwise everybody will be allowed to have visitors. We are still asking that you do outdoor visits if at all possible. So we discourage people from coming into the building, even though it is open and we are welcoming people in. We want to try to do them outdoors if possible. Obviously, if it's raining or if it gets cold, then come on in. And then I do have a new visitor fact sheet that will be posted at the front desk. So as visitors come in, please review that fact sheet and make sure you know all the rules. The basic rule is wear a face covering whenever you're visiting. Keep that on the entire time, so you won't be able to eat with your loved one at this time. As far as residents that are vaccinated, you can have close contact with your visitors. Those who are not vaccinated still need to practice social distancing. And with that, I would just say, if you're visiting and you're not vaccinated, just please be careful. You can, give your loved one a hug, or you can have a little bit of contact, but maybe try to keep social distancing as much as possible. I think that is primarily what I needed to talk about with COVID. I do have one other announcement though, and that is that we have hired a new DON, and we are very excited to announce that Emma Dunahee is going to be taking the position of Director of Nursing. And Emma, go ahead, applaud. Just in case she's watching, she'll know that she has great support here. Emma recognizes she's young and she's inexperienced, and it's not going to be an easy task for her, but she's up for the challenge and she feels directed by the Lord, and so we're very thankful for that. And she's going to be joining our team October 25th, or that week sometime, to start her training. We are going to take the training slow. She's going to spend several weeks with Lila and Brandon to learn the job and work with them. Lila will stay here at Fairview Haven at least for 3 or 4 weeks working with her. And then she will return to her office at Serenity Villa. However, she's probably going to maintain the title of interim DON until Emma feels comfortable taking on the title, so official title. So that is the plan with that. We're excited to have Emma back. She's been a PRN nurse here, for those of you that don't know, since she got her nursing license. And before that, she was a CNA here for many years. She even was volunteer here in activities, I believe, for a few years before she got a CNA. So we're thankful to have her and look forward to working with her. I believe that's all I have. So thank you very much for listening.